The following activity is presented by the Stanford Center for Continuing Medical Education. Please visit us at cme.stanford.edu.
Welcome to our Stanford Continuing Medical Education course, How to Taper Patients Off of Chronic Opioid Therapy. I'm Dr. Anna Lembke. Starting a patient on an opioid medication is easy, but getting a patient off can be hard. Given what we know today about the risks of chronic opioid exposure, ranging from dependence to increased pain to depression to death, we as healthcare providers are obliged to taper patients down and off of opioids when medically indicated. A 2016 survey of patients prescribed opioids for chronic pain found that more than 6 in 10 said doctors offered no advice on how or when to stop taking the drugs, and 1 in 5 said doctors provided insufficient information about the risk of side effects, including addiction. This course is designed for healthcare professionals who want to learn more about how to taper patients down and off of opioid medications in an outpatient ambulatory care setting, focusing on the chronic pain patient who has been on opioids for months to years. The basic strategies described in this course also apply to getting patients off of other controlled prescription drugs, such as benzodiazepines. The taper process is challenging in part because the medical profession has conflated compassion with more opioid prescribing. The short-term relief patients experience when first taking opioids or increasing the dose is also immediately gratifying for the doctor, who becomes a doctor in the first place to alleviate suffering. Yet the relief we provide short-term is counterbalanced by the potential harm we may inflict on patients by providing them with opioids long-term. Of course, every patient is a unique individual, and some may benefit from chronic opioid therapy. But recent CDC data show that as many as a quarter of patients taking opioids longer than 3 months will get addicted. Laura is a patient of mine who struggled with inexplicable chronic pain much of her life. She sought help from every sort of doctor over the years, many of whom treated her unkindly and without compassion. She was started on opioid pain-relieving medication and experienced immediate relief. But what followed was a half-decade of increasing doses of opioids, which did little in the long term to relieve pain and contributed to poorer function, physical dependence, although not addiction per se, and finally, hospitalization. Of note, the doctor who increased her opioids to the highest doses and encouraged her to take them liberally whenever she had pain was someone she remembers as the most caring and compassionate doctor she ever met.
She was like, you need to fight it, don't let it take over your life. And she stressed healthy eating, she stressed movement. I felt like she understood it better than people previously had. So after a couple of visits, she was the one that actually did start me on the opiates.
Laura's experience represents the central conundrum in tapering patients down and off of opioids. How can we as healthcare providers remain in a compassionate stance vis-a-vis our patients while shepherding them through the often painful process of an opioid taper? To begin, listen to Laura's story in her own words, describing how her pain began, how she first started on opioid medication, how her dose escalated over time, and what the effects were, and ultimately, how she got off of opioids. Following Laura's story, tune into our 5 brief educational videos, which outline the cardinal principles in tapering patients off of opioids. The mechanics of an opioid taper are easy. It's the art of the taper that takes some learning. The cardinal principles of the opioid taper spell out the acronym BRAVO. Broaching the subject. Risk-benefit calculator. Addiction happens. Velocity matters and so does validation, and other strategies for coping with pain. BRAVO is an apt rejoinder to patients and doctors who take on the difficult challenge of an opioid taper. So bravo to you for learning as much as you can about opioid tapering and for taking this course.